good.
Okay, go ahead.
Okay, you can actually go to the next slide. And as we get started, I'd really like to thank the BFI Ontario members who brought the topic being discussed at this presentation to our attention, because I strongly believe that when we work together, we have the best chance of making a difference. And before I get started, I will mention that I'm a volunteer with the Breastfeeding Committee for Canada and BFI Ontario, and I have no financial disclosure to report. I've been involved with the Baby Friendly Initiative for many years, nationally and provincially and locally, and wholeheartedly believe in the protection, promotion, and support of breastfeeding through the Baby Friendly Initiative. If you go to the next slide, Louise, you can see the objectives of the presentation on this slide. And first of all, we'll look at some of the key points in the Public Health Ontario question and answer document. And then we'll review the Breastfeeding Committee for Canada's procedure to help facilities remain accountable and maintain the Baby Friendly Initiative standards after BFI designation. Then we will explore some of the reasons to implement the BFI standards and become BFI designated, and also some of the hurdles or the barriers associated with that. And then lastly, we'll review BFI Ontario's response to the Public Health Ontario document and our next steps. If you move to the next slide, there it is. If you move to the next slide, what we have here is the first page of the Public Health Ontario question and answer document. And the link is there for those of you who haven't had a chance to read it yet. The document is a quick read. It's 6 pages, and the information is divided into sections and presented using bullets, and the last few pages are the references, the citation, and the disclaimers. If you go to the next slide, that actually shows some excerpts from the last page. And if you look under citation, you will see that the document was first published in 2020. And the disclaimers indicate that the document was developed by Public Health Ontario and that the application and use are the responsibility of the user. So what this means is that following the guidance in the document is the decision of each health unit, and that Public Health Ontario assumes no liability for the outcomes. So this is a guidance document, not a mandated document. Next slide. So the Public Health Ontario question and answer document indicates that the information is based on a systematic review from the US Preventive Services Task Force, and that the review was done in 2016. I looked up what the US Preventive Task Force is, and they've been around since 1984. And the members come from fields of preventive medicine and primary care. And their role is to develop recommendations for clinical preventive services based on research. And the review that they did, that is the basis of the Q&A Public Health Ontario document, is actually a lengthy document, 159 pages. I read most of those pages and did find that the task force said that the purpose of the document was to update their 2009 recommendations on breastfeeding counseling and support. So the purpose of their document was not about BFHI designation or redesignation. And I think the importance of that will become more evident to you as we continue on with this presentation. So if you move to the next slide, There we go. The first bullet on this slide is one of the key messages in the Public Health Ontario document. And we know that breastfeeding is the optimal source of nutrition for the first 6 months of life. And breastfeeding is considered in the Ontario Public Health Standards. And these are the standards that the public health units follow. Myself, when I read that, I certainly agreed with the statement, but I was disappointed that the global infant feeding recommendation of exclusive breastfeeding for 6 months and continued breastfeeding to the age of 2 years and beyond wasn't mentioned. The next point we also are well aware of, and that's that there's extensive research to support the 10 steps to successful breastfeeding, and the fact that BFI implementation of the 10 steps improves breastfeeding rates. If you go to the next slide, you can see the other two key points that were made. And I think the next key message is interesting, because if you read the US Preventive Services Task Force document, you'll see that only 2 studies of the 52 studies that met their criteria for inclusion looked at breastfeeding rates at BFI designated hospitals compared to non-BFI designated hospitals. And both of the studies had the same authors. One of the studies found that there was an increased initiation rate and an increased rate of exclusive breastfeeding for 4 or more weeks in mothers with 12 or fewer years of education in BFI designated hospitals compared to hospitals that weren't BFI designated. And then the other study of the 2 studies found that mothers giving birth in BFI designated facilities were more likely to report experiencing at least 7 of the 10 steps in terms of practice compared to mothers giving birth at hospitals that weren't designated, but compliance with the individual steps was low. And what the researchers concluded was that the number of steps implemented is what is important and not BFI designation. And I think this is something that the Public Health Ontario Q&A document grabbed onto. The task force document, that lengthy document of 159 pages, does say that there's a need for further research that looks at system level changes on breastfeeding rates and rates in BFI designated hospitals compared to non-BFI designated hospitals. So I think that that's really important. If you go to the next slide, you'll see that something that really surprised me, and that's this statement that was in the Public Health Ontario Q&A document. And so what I did in response to reading the statement was to look at the reference, and the reference was the WHO and UNICEF 2017 guideline document. And I searched through the entire document and couldn't find anything that even implied that the update was done to incorporate evidence on the harms of BFI implementation or the harms of BFI designation. So that was quite a surprise to see that statement there. If you go to the next slide, what you'll see are the WHO and UNICEF documents that came out after that 2017 document. And the one on the left is the implementation guidance document, and that was put forward in 2018, and it was based on public consultation to that 2017 document that we saw in the previous slide. And then in 2020, WHO and UNICEF provided a frequently asked questions document just to clarify some of the information in that 2018 document. Okay, so moving forward to the next slide. the Public Health Ontario document states that there continues to be debate about the effectiveness of baby-friendly initiative designation. So when I read that statement, if you go to the next slide, Louise, I decided to look at what WHO and UNICEF say about this. And so if you go to that 2018 BFI implementation document, and that's the baseline for all of our BFI standards, what that document states is the recommendation for external assessment to evaluate the adherence to the 10 steps. And they also report that the baby-friendly initiative journey to become designated results in improved quality of care for breastfeeding. Okay, and if you move along to the next slide, and this is still information from that same BFI implementation guidance document, the one concern that was identified about BFI designation is indicated here. And what the challenge that facilities have is sustaining the practice changes that they made when becoming BFI designated. And unless regular monitoring systems are in place, it's easy for facilities to revert back to former practices and not consistently meet the BFI standards. And that is something that we've actually found provincially and nationally as well. So if you go to the next slide, this also is an excerpt from the implementation guidance document, and it shows that WHO and UNICEF are supportive of countries with a well-functioning BFI designation program. So they really are supportive of a program such as the one that we have in Canada. And as we carry on with this presentation, hopefully it will become clear to you why. So if you go to the next slide, we can see what the updated document, that 2020 document, frequently asked questions, what it says. And there was actually a question about BFI designation on page 9 of that document. And what the response shows is that BFI designation or some other process that facilitates the implementation and the maintenance of the 10 steps is what is advised. Okay, so let's carry on to the next slide. And what you see on this slide is the 2018 WHO UNICEF implementation guidance document, and that forms the basis of national standards in our country and also other countries. The middle document is actually the cover page of our Canadian BFI standards. It's called the BFI implementation guideline. And then a companion document is the picture on the right. And that's our process and cost document. And if you go to the next slide, Louise, people can get the link for the process and cost document. And this document is really important because it gives you all of the milestones of the baby-friendly initiative journey and indicates the associated costs of pre-assessment and external assessment. Okay, and moving to the next slide, what we have on this slide is really important for facilities that are in the BFI journey and also facilities after they have achieved designation. So if you look at the 10 steps, you'll see that step 1 is divided into 3 parts, and step 1C is something new that was in the 2018 WHO UNICEF document and is also in our Canadian standards. And it's really important because what it's about is ongoing BFI monitoring and data management. And it includes breastfeeding surveillance, which we've always wanted, but also monitoring of the key clinical practices found in steps 3 to 10. And that monitoring facilitates continuous quality improvement. Okay, so you can see that information in the big triangle. Now, the three pink boxes, what they are the reports that are required by the Breastfeeding Committee for Canada once a facility becomes BFI designated. And the first is a self-monitoring report, and that is due annually, so once a year. The middle one is the BFI interim report, and that's a more comprehensive report. The facilities provide us, every 2 years. And then finally, on the anniversary date of their BFI designation, external assessment is required once again to make sure that the standards are being maintained. And the reason for this is really accountability on the part of the hospital or community health service that is BFI designated, but also accountability for the Breastfeeding Committee for Canada to WHO and UNICEF. Okay, so if we move to the next slide, what I've done in this slide is looked at some of the advantages and some of the hurdles or barriers to BFI implementation. So implementation of those 10 steps to successful breastfeeding. And there's certainly lots of research to support each of the 10 steps. We know that from that WHO UNICEF document, and also for the BFI implementation guideline that we have in Canada. And the 10 steps are a minimum standard of care for perinatal families. And implementation of the 10 steps has been shown to improve breastfeeding rates, also improved health outcomes for babies and for mothers. And this in turn saves healthcare dollars. And all of that improves over time, of course, to the savings of the healthcare dollars and the improved health outcomes. Right now, the Breastfeeding Committee for Canada has some grant money from the Public Health Agency of Canada. So there's also assistance for hospitals and community health services with their BFI journey through the Coach Mentor program. And I know that you've received information about that at earlier meetings that you've had from BFI Ontario, and also some of our social media postings and so on. In terms of some of the barriers, they include things like the time commitment for the implementation of the 10 steps. This could include policy and practice, adjustments, staff education, skill building sessions. Also, of course, we need management commitment to the implementation of the 10 steps, and also staff agreement and commitment to the Baby Friendly Initiative implementation. I think there are some financial considerations for implementing the 10 steps, and these would, of course, be the cost of educational sessions, and also time spent on BFI is time not spent on something else. And a lot of these reasons, I'm sure facilities have thought about in their consideration of whether or not to implement BFI. If you go to the next slide, what that slide is looking at is what about BFI designation? And one of the values of BFI designation that I've heard over and over from facilities is that the facility really values receiving unbiased feedback about their practices and suggestions of ways to strengthen their practices. Facilities want to provide excellent care, and having an outside evaluation really helps to give them a sense of where they are at with that. Also, BFI designation provides the public with transparency so that they know what to expect when they receive services from the facility, and they also know they're receiving care based on international standards that are supported by research. And that's really quite important. On the con side, you'll see some of the same barriers as the ones that were on the previous slide. But I think one of the hurdles certainly that's become evident recently is management commitment to BFI designation, time considerations, and the financial aspects such as staffing, education and skill building, and the actual costs of pre-assessment and external assessment. So if you move to the next slide, there's other factors that I think need to be considered in the discussion, and I've put some of them up on this slide just in thinking clouds. So in 2018, the Public Health Agency of Canada awarded the Breastfeeding Committee for Canada with a grant for a 5-year project to enhance the implementation of the Baby Friendly Initiative in our country. And then just this past fall, in November actually, Health Standards Organization of Accreditation Canada recognized the Baby Friendly Initiative as a leading practice. And you could read about this in their November newsletter. So this really shows federal support for the Baby Friendly Initiative and Baby Friendly Initiative designation. Also, another consideration is that accreditation is something that we do value in healthcare. When I think about that, I think about hospitals, they're accredited, long-term care facilities, veterinary practices. These places are accredited, and that's showing the public that there are standards that are to be followed and are being followed. Another point that I think is quite relevant is the research of Dr. Sandra Hoy from Laurentian University, and this information was presented in a webinar offered by the Breastfeeding Committee for Canada this past fall. And what Dr. Sandra Hoy's study looked at was the cost of suboptimal breastfeeding rates to the Ontario healthcare system and the savings of exclusive breastfeeding if the rate of exclusive breastfeeding was the same as it is at the time of discharge from the hospital, and that's 65%. What her studies found is that about 73 million US dollars would be saved if Ontario could bump up that exclusive breastfeeding rate at 6 months to 65%. So you may think, but where are we now? And what the data that we have available shows is that at 6 months, 36% of babies are exclusively breastfed, which is much lower than the global target of 50% by 2025. That's only 2 years away, and 70% by 2030. So that's important information also to consider in this discussion. So if you move along to the next slide, I did check, and there has been some further research since the report that was done by that US task force. And that was the basis of the Public Health Ontario document. And there were 3 studies that I found that were particularly relevant for us to look at. And this first one here was published in August 2017. And what it was a cross-sectional study that took place in Switzerland. And they compared the exclusive and any breastfeeding rates according to BFI designation for the first year of life. And what the researchers found was that the average duration of exclusive breastfeeding and any breastfeeding were longest for babies born in currently BFI designated hospitals. And so this, the researchers concluded that it really reinforced the accreditation of hospitals as baby friendly, and investing in compliance was the way to reach and maintain high prevalence and long duration of breastfeeding. The second study was published in the Midwifery Journal in just this past July 2022, and the study looked at postnatal and one NICU in a public birth hospital in Finland, and the hospital's BFI designation had a positive impact on breastfeeding support from a maternal standpoint. They administered a 20-item questionnaire to the people, and according to maternal perception, breastfeeding support in the hospital was more adherent to the evidence-based standards of BFI after designation compared to prior to BFI designation. So maternal perception was that the practices were being followed more closely after designation. And then if you go to the next slide, Louise, you'll see the third study that I found was quite important. And this one was done in 2021. And what this study looked at was the social value of maintaining BFI designation in one public maternity unit in Australia using something called the social return on investment framework. And I read what this social return on investment framework was, and what it does is measure social and environmental and economic outcomes of change using monetary values. And what the researchers found that was for every $1 Australian currency invested in maintaining a baby-friendly initiative designation, that every dollar generated approximately $55 Australian of benefit at this facility. And so the researchers concluded that scaled up nationally, the baby-friendly initiative could provide important benefits to the Australian healthcare system and also to the national economy. And so BFI, they really viewed as an investment in the health and well-being of families and communities and the Australian economy, and also health equity. Okay, if you go to the next slide, what you'll see is the action that BFI Ontario has taken in response to that Public Health Ontario document. And what we did was we wrote a letter to Public Health Ontario, and that same letter was sent to all the medical officers of health of the health units across the province. And a briefing note was sent to the BFI Ontario membership, and that contained the same information that was in the letters. And then we've got this hot topic at our meeting today. And I'm going to leave you with a question that you can see on the next slide. And, you know, I'm wondering, what do you think should be our next step? We, you know, need some we're doing some advocacy to try and have a provincial government rep be involved with BFI Ontario. We had this prior to the pandemic, and we're really doing outreach to try and make that happen again. We'll do any follow-up to responses to the letters that we sent out. And the Public Health Ontario document and our response has been shared with the Breastfeeding Committee for Canada because it's important information for other provinces and territories to be aware of. And then the next slide has the question where we're really looking for your input. And what the question is how can you advocate for implementation of the 10 steps and BFI designation, redesignation? What do you think your next step should be? And do you have suggestions for BFI Ontario's next steps? So I'd like to open it to the group for some discussion of this. Also, I'll address any questions that anyone might have.
Thank you so much, Marg, for that fabulous presentation. And and looking up all the most current research and up-to-date stuff. Some pretty exciting information you shared there. The Australian one with $1 invested equals $55 of improved or savings is a pretty exciting article. So thank you. Is there anyone that has some comments or questions for Marg that we can pose here? You can put up your, oh, okay, sorry, Angie, I see you there. If you want to unmute yourself, Angie.
Hi there. Hi, everyone. So I just wanted to share maybe the experience. I work at Timiskaming Health Unit, but today I'm not representing Timiskaming Health Unit. But we have since, unfortunately, decided not to redesignate. And I tried my hardest to lobby for this. Unfortunately, I was not successful. I wonder if the approach is not to go to each medical officer of health or each health unit individually, which is helpful or could be, but the response at my health unit was, well, so few health units in Ontario are redesignating, so why should we? I wonder also if it's worth more push at the provincial level to see if it can be part of the accountability standards again. I know there was a big push by MOHs to remove that piece quite a few years ago, but if it's from the top down approach, it might generate more interest. The one argument that I used was exactly what Mark presented about the accountability factor, where, you know, if you're not accountable to a governing body, how do you know that your practices will be maintained? Because eventually we do tend to slip or let go of certain practices, and every which way I tried to spin it, unfortunately, was a no-go. So I wonder if a top-down approach might be a way to go. Thank you.
Thank you, Angie, for your efforts to try to get the health unit to redesignate. I think the redistribution of that Public Health Ontario question and answer document in the fall, because I did learn from some BFI Ontario members that it was sent out to the various health units also this fall, not just in 2020. I think that has impacted a lot of the health units, and certainly you're right, when BFI designation was in the accountability agreement, and you know, that was 2014 to 2016. I think, and it initially was in 2011, I think, and then was renewed. There was a lot of health units working, all of them in essence, were working on BFI implementation and moving forward to designation. And I know from the data that BFI Ontario collected that in 2011, for example, there were 7 public health units in Ontario that were BFI designated. And then by 2018, 26 had achieved BFI designation, which is 74% of them. And 6 of those had been redesignated. We're in the process of updating our list of BFI designated facilities. Certainly things have been on hold a little bit, and grace periods granted to designated facilities throughout the pandemic, but that list is being updated. But I will absolutely guarantee that we don't have 26 that are BFI designated right now, because some have indicated that they're not planning to redesignate. Great,
thanks. Is there any other questions anybody would like to raise? There is a comment here. I wish you could present to all of the hospital executive organizations with all this great evidence-based information. And what I would say is that this is a recording, and certainly share it with your managers, and you know, that is a way for you to be able to connect with some higher level people within your own organizations. Unfortunately, we don't have a lot of contact with each organization to be able to do presentations, but certainly, as I said, this is recorded and you're welcome to share it.
I would also like to say to the BFI Ontario membership that I really think that discernment is so important when you're receiving documents. You know, reviewing the references was such a valuable exercise for me because I found out what the source actually said, and it was quite different than the material that was in the Public Health Ontario Q&A document. So I would really encourage discernment when you receive any document, even if it's something provided, you know, by Public Health Ontario or your favorite researcher or whoever. You know, check it out and read it with a discerning eye. Also, I really think that communication between the membership and BFI Ontario is absolutely crucial. If we hadn't heard about this from you, we wouldn't have been able to respond at all. So I think those doors of communication really are so important. So I encourage, you know, if something is out there, don't assume that BFI Ontario is aware. You need to communicate it to us. So I really would encourage that on your part.
Okay, I'm not seeing any other hands raised at this time, so I'm going to stop the recording and then we'll move on.